Magandang araw sa inyong lahat and welcome to our first ever pre-recorded lecture for the subject Concepts in Pediatrics. My name is Dr. Jeffrey Reboron and I will be your instructor. Before we begin, I would like to present our course objectives. At the end of the course, you as a student of midwifery is expected to demonstrate adequate knowledge and skills that are needed in the provision of basic midwifery and pediatric care to your patients and their different life stages, including the neonatal stage, infancy, toddlerhood, preschool period, school age, and adolescent period. Now, for this module, you're expected also to have a better understanding on the concepts of growth and development, and to apply the 4 widely accepted theories that are surrounding the concepts of growth and development in your clinical practice. So let's begin. It is important that you have a clear grasp of the concepts of growth and development. So let us have a definition of terms. When we talk about growth, it simply means the increase in body size or increase in height or weight. And this occurs through cell division and protein synthesis. So pag yung isang bata lumalaki or bumibigat, that coincides to growth. However, we also have another term called development. And it is defined as the gradual growth from a lower to a more progressive skill and capacity to function. So kung kanina, growth pertains to height and weight, dito naman sa development, it pertains to the cognitive and the moral skills of an individual. So ang ibig sabihin nito, it revolves around the capacity of an individual to perform a specific skill or specific tasks. For example, when we talk about writing, a child who can only write an alphabet can be developed and become a person who is very good when it comes to writing cursive. So, idi ubing kayo, you can only write letters nga agsisina, but as you become older and you develop your skills more, you can already write in cursive or agsisilpo. So, that is basically the meaning of development. And we also have what we call maturation, and it is the state of readiness wherein the body is more fulfilled or prepared to fulfill its function. So dito po, this does not pertain to the skill of an individual to become more mature, hindi po yon. When we say maturation, it is the state of readiness for a body to fulfill its function, its intended function. Let's take, for example, the case of the breast of women. We cannot say that the breast of a 12-year-old girl is already matured if it is not yet prepared for breastfeeding. Sinabi natin kanina that an organ is mature already if it is already able to fulfill its function. And what is the function of the female breast? It is for breastfeeding, tama po ba? So, if an individual is not yet, or an organ is not yet ready to fulfill its function, then it is not yet mature. Another example will be the male penis. So, the penis of a 3-year-old boy is not yet mature because it is not yet ready for copulation or coitus. Hindi pa siya pwedeng mag-impregnate ng isang babae. But if that individual already has a mature penis, it can already fulfill its functions of reproduction. So that child or that person can already have a penis which is capable for reproduction, capable for sex, and capable of coitus. So that is what we mean when we say maturation. It is the state of readiness of a bodily organ wherein it is already prepared to fulfill its function. So those are the different concepts of growth and development. So pag sinabi natin growth, it is in the increase in height or weight or body size. Pag sinabi nating development, it is the progress of skill or capacity to function. But when we say maturation, it is the preparedness of an organ to fulfill its intended function. Claro? All right. We proceed to the next slide. And we have the principles of growth and development. You have to remember that growth and development both occur in regular conditions and they reflect a definite and predictable pattern or trend. Sabi nila, yung growth and development daw ng isang individual ay nakikita natin na predictable. Pare-pareho tayo ng mga series of processes na ina-undergo for us to grow and develop. Now, the most common principle of growth and development is what we call the directional trend. Okay? Sabi dito, growth and development follows a regular direction. Okay? At yung first na example natin ng directional trend is cephalocaudal growth. Sabi dito, growth starts from the head going to the toe. Kaya siya tinawag na cephalo, meaning head, and caudal, meaning tail. So sabi dito, the growth of an individual begins at the head and then ends in the toes. So example, when an individual or a baby is born, the biggest organ of the body is the head. Mapapansin natin that it occupies almost 1/4 of the total length of the child, of the infant. So that is a great example that growth and development really begins from the head and ends in the toes. Aside from that, makikita din natin that the child first learns to lift his head before he can control the rest of his body part. That is also a sign of development that is cephalocaudal. Unang nakokontrol ng bata yung kanyang ulo, tumatango-tango siya, before he can control the rest of his body parts. Another trend, directional trend when it comes to growth and development is what we call proximodistal. Okay? Sabi dito, the growth and development begins from the center of the body and ends in the extremities or the distal portions of the body. A good example of this is the grasping of the pencil. A child first have to develop his arm movements. Dapat kaya niya munang igalaw yung kanyang mga braso before he can proceed to moving his hands. And then after moving his hands, pwede na siyang mag-grasp ng mga objects. He will again proceed to another development which is his fine finger movements. So kung mapapansin nyo, nung elementary days ninyo, your pencil is colored black, yung mga matataba. That is needed for you to be able to grasp the pencil properly kasi nga hindi pa ninyo na-develop yung fine finger movements. So yung mga lapis na ginagamit ninyo before were very wide in diameter. But as you grow older, you are able to control your fingers properly kaya yung mga lapis na ginagamit nyo nagiging manipis na din. So that is an example of a proximodistal directional trend of growth and development. We also have what we call the mass-specific or differentiation trend. The childs first have to master simple operations before performing complex functions. Anong ibig sabihin nito? That we start doing simple things or simple activities first before we try to perform complex activities. A good example of this, so it's also known as your gross defined. So a good example of this is that the child learns to put on a shoe first bago siya mag-tie ng shoelace. So mas madali kasing skill ang putting on a shoe rather than tying a shoelace. Okay, so in the picture, you can see a child who is holding a crayon and he is attempting to create art. And what is the outcome of the art? It's very simplistic drawing. It's a very simplistic drawing of an elephant. And as the child progresses, nag-i-improve yung kanyang drawing up to the time wherein he is already able to perform complex paintings such as this. Now, another example is what we call sequential trend. So, sabi dito, it involves a series of steps or procedures before an individual can perform a specific function. We take into consideration locomotion or the movement of the child. So, makikita nyo, the child, all of us, will start to crawl first. And then we will creep or agpampanchok, or we will try to stand on our own. And then after that, we will walk assisted, or we will walk while holding on to rails, or we will hold on to the edges of tables. And then basically, we will already be able to walk independently. So that is what we call sequential trend. Merong series of steps na fina-follow yung growth and development ng isang bata. Awan pa'y tinakitak nga ubing nga nayanak nga imo nga timmaray sa abay nga nagbakam-bakam. So that's the proper sequence of things. Meron tayong sinusunod na pagkasunod-sunod ng mga bagay-bagay when it comes to growth and development. And lastly, we also have what we call secular trend, wherein there is a worldwide change in the rate and age of maturation. Kung mapapansin nyo, there are individuals who are very tall already, but they are only 16 or 18 years old, especially when they come from other countries. So, nang ibig sabihin niyan is that the growth and development rate varies from place to place, from race to race. So, secularity ang ibig sabihin nun. Aside from that, we can also take into consideration menstruation. Yung mga bata before, they were having their menstruation at around 15, 16, 17. Nung batch ko, ganun yung mga edad ng mga menarche nila or your first menstruation. However, as time passed by, we already see a trend, secular trend for girls who are having their menstruation at an early age of 11, 12, and 13 compared to the previous years. So that is also another example of secularity when it comes to growth and development. Nagkakaiba-iba based on the time period, based on the geographical location. So, mapapansin natin, when we look at these individuals, both of them are 25 years old. However, the kid, the person on the left looks a lot younger than the person on the right. So, ibig sabihin, we can assume that the lady on the right looks matured, looks older than the person on the left. So, that is the secularity of the trend of the growth and development of an individual. All right. We also have the principle of asynchronous growth. Anong ibig sabihin nito? That not all of our body parts will grow at the same time and all at once. Hindi po pwedeng sabay-sabay na lumaki or mag-improve yung mga different body parts natin ng sabay-sabay, because basically the body will need a big amount of energy to develop a specific organ or a specific skill. So hindi po kaya ng katawan natin na agad-agad i-push yung kanilang mga body organs to grow and develop. Kaya nga meron tayong principle of asynchronous growth, meaning that there are that our growth and development do not really occur at once and at the same time. Now, you also have to remember that growth and development is always a continuous process, and it begins from conception and ends in death. So during conception, after the meeting of the egg cell and the sperm cell, doon pa lang po meron ka nang na-experience na growth, because there is already cell division during that time. As you grow older, meron pa ring growth and development. Pag pinanganak ka, pag matanda ka na, kahit na uugod-ugod ka na, you are still experiencing growth and development. Gaya nga ng sabi nila, growth and development starts from womb and ends in the tomb. Kaya, anong ibig sabihin nito? You also have to remember na basta buhay ka, there is a chance for you to grow and develop and improve. Now, you also have to remember that play is vital to the life of the child. So, very important din ang play sa growth and development ng isang individual. Like I said, play is also the universal language and is central to the life of a child. Bakit siya tinawag na universal language? Well, if you put an Asian kid, an African American kid, an American and a Filipino inside one room, hindi sila magkakaparehas ng language na ginagamit. However, when you allow them to play with each other, their language really doesn't matter anymore. Magkakaintindihan sila pag sila ay naglalaro. And that is the reason why play is considered the universal language of a child. Now, you also have to remember that when it comes to development, a great deal of skill and behavior is always learned via practice. Hindi po tayo pinapanganak na kahit wala tayong ginagawa ay nag-i-improve na yung mga skills natin. That is not the case. So, kunwari, you want your cognitive level or mental functioning to improve, you have to practice. Wala pong pinanganak na agad-agad magaling, agad-agad matalino. A great deal of our skill and behavior is always learned by practice. So if we want to develop our skills, you have to always make sure that you allot some of your time practicing. And lastly, you have to remember that each child is unique. All of us, even twins, have our differences and we have our different strengths and weaknesses. So what does this mean? As midwives, you have to remember that there should be a specific care that you give to a specific individual. Hindi po pwede yung template na lang na generic approach when it comes to caring for children. You have to make sure that the care you are giving to your patients are tailor-made based on the needs of the patient. So, hindi po pwedeng yung mga binibigay mong intervention sa isang bata ay kokopyahin mo at gagawin mo ulit yon sa isang bata din. That is not the case when it comes to midwifery practice. Dapat po individualized yung care na pinibigay natin sa isang bata. Even if the person has special needs or it should always be individualized. Now let us also talk about the major factors that influence growth and development of an individual. As they say, there are two major factors which we call nature and nurture. Anong ibig sabihin nito? That an individual's growth and development may be influenced by the genetic makeup, yung mga namana niya sa kanyang mga family members. However, they also claim that an individual's growth and development can also be influenced by the environment kung saan siya lumaki. And that is what we call nurture. So, let's look at this. The first factor that affects the growth and development of a person is what we call the genetic factor. This means that the basic genetic makeup of an individual that makes a child unique, also known as hereditary, is influencing how we grow and develop. Anong ibig sabihin nito? Na kung yung nanay at tatay mo ay may mga certain characteristics, those can also influence your growth and development. Maaari mong mamana yung mga yon, and those can affect how you grow and develop as an individual. Now, under these genetic factors, we have the race and nationality of a person. So, some races are tall. Yung mga Nigerians, yung mga Americans, Germans, they are really very tall. And that is because of their race and nationality. Nasa dugo kasi nila na matatangkad sila. Some are short, like Koreans, Taiwanese, Filipinos. So that's based on the genetic makeup of an individual. Another genetic factor that can affect your growth and development is the sex or your gender. Sabi nila, girls are born lighter than boys by an ounce or two. And height can also be influenced by not gender but basically sex. Tingnan nyo, when you were still in elementary, The girls there were very tall. Mas matatangkad yung mga babae kaysa sa mga lalaki during that time. Why? Because when you are a female, it is expected that you will undergo growth spurt or biglaang paglaki during those time. So yung mga lalaki, ang liliit nila. However, if you are a boy, it is also expected that your growth spurt will come during your adolescent period. So pag naging 13, 14, 15 na yung mga boys, nagiging sobrang tangkad na sila. So that is one example of how sex influences growth and development. Another example is cognitive level or cognitive functioning. Sinabi nila that boys are generally more intelligent than girls kasi nga when you are a boy, you have a bigger brain. And so it is presumed that because of that, you are more intelligent than females. Aside from that, girls kasi, they menstruate. Nagre-regla sila. And because of that, they have a monthly blood loss. And because of that blood loss, there is far fewer oxygen and blood that goes to the brain. Kaya nga po, yung mga babae daw, they are not capable of rational thinking because their brains are not receiving the ample amount of oxygen needed kasi nga nireregla sila every month. But as for now, we are already trying to change that notion and we are trying to prove to the world that boys and girls are the same. However, that example that I presented are great examples of how sex affects the growth and development of a person. Sabi din nila, the intelligence level of a child can also affect how he or she grows and develops. Paano yun? Kung mas matalino ka daw, if you are more intelligent, you tend to grow less. Mas konti daw yung growth mo kung ikaw ay matalino. Compared kung yung isang bata na hindi masyadong matalino, there is a bigger chance na yun yung mas tatangkad or lalaki. Let's have a look at this. Yung isang bata, kunwari, na napakatalino, the intelligence level of the child is very high. Mas interested yan na magbabasa ng libro, maglalaro ng chess, manunood ng mga educational channels, and because of that, the motor development of that child is decreased. Wala siyang masyadong mga physical exercises. So, ibig sabihin, hindi na-exercise or nababanat yung kanyang mga bato, yung kanyang mga muscles. Therefore, tumatalino nga siya. The child is developing, but the child is not growing properly. Okay po? Now, let's take for example another individual who is not that smart and not that interested when it comes to information, processing information. Yung batang yon, you do not expect him to be reading books or you don't expect him to be watching educational channels. Ang ginagawa niya, naglalaro ng basketball, nakikipagpatintero, and other things like that. And because his motor skills are developed at because yung kanyang mga bones and muscles are being used and tested to its limits, mas nag-grow and nagde-develop siya. So there is a higher possibility for that child to become taller or to become more bulky compared to an intelligent child. So that is how intelligence level of an individual will affect the growth and development. Now, aside from that, we also have the health of an individual, which can influence growth and development. Sabi dito, a child who inherits genetically transmitted diseases may not grow as rapidly as others do. May mga pinapamana kasing mga sakit or mga conditions ang mga parents natin that may hinder us from growing and developing properly. Number 1 dyan po ay yung mga sakit sa newborn screening, which is your congenital hypothyroidism, yung mga G6PD, yung mga yun po ay yung mga sakit na yun na binanggit ko, they do not allow an individual to grow and develop normally. So yung health pa lang na yun, yung mga conditions na yun na pinamana ng mga magulang natin sa atin, they can affect growth and development. Ano pa? Yung mga pwede nilang maipamana sa atin. We also have your cancer, diabetes, hypertension. Those are disease conditions that may hinder us from ever growing and developing. So those are the factors that are related to genetics, nature of an individual. Now we also have environmental influences or what we call nurture, kung saan ka lumaki. Sabi dito, although a child cannot grow taller than their genetically programmed height potential allows, other factors may still hinder growth and development. So ibig sabihin dito, yung paglaki daw ng bata ay hindi lamang po influence ng kanyang genetics. It can also be influenced by the environment. Let's have a look. The socioeconomic level of an individual can affect his growth and development. Why? Because children, for example, children who are born of poor families, galing siya sa isang mahirap na pamilya, they cannot afford good nutrition. So ang ibig sabihin niyan, the child is not eating properly. The child is not receiving any vaccination. So the child will become vulnerable to diseases. Ang mangyayari, yung batang yun magiging sakitin, and that child, even if matatangkad yung mga nanay at tatay niya, he will not grow and develop properly. So like I said, socio-economic level of a person can affect growth and development. Mas mayaman, mas mataas yung chance na mag-grow and develop normally, mas mahirap, mas challenging ang growth and development. Another environmental influence is the ordinal position in the family. According to Adele Piliteri, a child who is the eldest or the only child tends to develop his language skills faster because he talks to adults more often. So yung mga bata daw na only child or eldest dahil sa wala pa silang masyadong kalaro na bata, yung kinakausap nila ay yung mga nanay at tatay lang nila. Therefore, nag-i-improve yung kanilang mga language skills because they talk to adults more often. That child also tends to become more healthy pag ikaw ay only child or eldest. Bakit? Because all the attention and funds and budget goes to that child. Kaya nga afford ng nanay at tatay yung mga kailangan ng bata pag siya ay eldest at siya ay only child kasi nag-iisa pa lang siya. But when the person is born to a family of 7 kids, so pang 7 ka, do you expect that they will be able to give you the needed food, the needed education that you need? Hindi po. Hindi nila maa-afford yon. So therefore, maaari yung bata, yung bunso, ang pinakakulelat when it comes to growth and development kasi nga wala nang halos pondo at attention na napupunta sa kanya. So that is one great example of how ordinal position in the family no may kamanuka that influences the growth and development. Sabi din dito, children learn by watching other children. And the eldest, since they do not have anyone to watch as an example, they tend to be very poor on toilet training. So mas mahina daw sa toilet training yung mga eldest or the only child kasi nga hindi sila nakakapanood ng mga ibang individuals kung paano gamitin yung toilet. But when you are the youngest individual, you get to see how your brothers and sisters go to the toilet. Kaya nagagaya mo sila. Therefore, you have better toilet training than the eldest and the only child. Another factor that influence the growth and development, which is part of the environmental factor, is the parent-child relationship. Children who are loved, they thrive better than those who are not. So mas maganda yung kanilang paglaki pag sila ay minamahal at inaalagaan. There is also a loss in desire to eat and play when there is disrupted parent-child relationship. Kung yung bata nagtatampo, kung yung bata hindi niya nararamdaman na mahal siya ng mga magulang niya, tendency, wala siyang ganang maglaro, kumain, makipag-usap, and other things like that. And because of his withdrawal to perform those kinds of things, maaaring that will hinder his growth and development. So always remember that parent-child relationship affects the growth and development of a kid. Now, we also have illness and injury. Children who contract specific diseases such as diabetes, kasi nga environmental disease po yung diabetes, aside from hereditary, pwede pong yung mga kaklase niya mahilig kumakain ng mga matatamis na pagkain, so that can also happen. Pwedeng magka-diabetes yung bata, or pwedeng magka-hyperthyroidism, or pwede siyang magka-polio. Those are environmental problems. Those illnesses or injury can influence the growth of a child. So always remember may mga sakit po tayong nakukuha in the environment in itself na pwedeng mag-influence ng ating growth and development. Cholera is one. Agtaki. Tuberculosis or primary complex is also one. Pag yung bata nagka-TB, you can expect na hindi na siya lalaki. Typhus or typhoid fever. Those are examples of illnesses or injuries that occur in the environment. Aside from that, exercise and stimulation of a child can also affect how he grows and develops. A child who is denied of play, hindi siya pinapayagang maglaro, they tend to become poorly developed and they may have hindered growth. Yung mga batang hindi tinuturuan or sinistimulate ng mga magulang to read, to write their names, they tend to also become poorly developed. Baka lumaki siyang hindi masyadong magaling. Okay? So always remember that another environmental factor is exercise and stimulation that can influence the growth and development of an individual. And lastly, nutrition. What you eat, what you put inside your body affects your growth and development. When the mother has poor maternal nutrition when she was conceiving a child, hindi siya kumakain ng maigi habang buntis pa siya, that can affect the growth and intelligence of a child. Diet can also influence how a child grows and develops. Kung yung bata po mahilig kumain ng mga matatamis at matatabang pagkain, he will become obese. So nag-grow and nag-develop nga siya, pero maaaring mag-develop din siya ng mga maraming sakit. So always remember that nutrition of an individual is also considered an external factor which can influence how a child grows and develops. So those po are the different factors that affect our growth and development. And that concludes our first session for the topic Concepts on Growth and Development. I hope you enjoyed the class as much as I did. I will have to make an assessment on how much you have learned, so make sure to log on to your Edmodo and look for the channel for your quiz. Also, I will be expecting your formative assessment and graded assignments to be passed via Edmodo, Facebook Messenger, or through email. Again, maraming salamat for spending time with me. Keep safe, God bless, and please stay alive. Maraming salamat po.